In meaningful use, particularly the technologies that the providers are using need to have a level of certification. The initial certification process was really tailored towards electronic medical records, those clinical systems. But now with the criteria really shifting towards patient engagement, we are focused on being meaningfully use certified and making our technology available for those providers to check the box for their attestation purposes. And so the patient engagement criteria, we are modularly certified for the 2014 edition criteria as identified by the Office of National Coordinator for Health IT. And these criteria include view, download, transmit to a third party. They include patient-specified educational resources, secured messaging, also all the privacy and security criteria, and automated numerator reporting are really those that fall into our modular certified bucket.
I'm extremely proud of our whole team. It has been extremely challenging to get to where we are, but we've put in long hours, dedication. You know, the last 3 weeks before certification, it's one thing after another, figuring out exactly what's in all the test scripts. We've been real trailblazers in meaningful use stage 2 with a lot of the patient-centric objectives.
Meaningful use all stems from the American Recovery and Reinvestment Act. So think about all of the new bridges and the new streets and on the signs that says brought to you by and from the American Recovery and Reinvestment Act. Well, part of that act also included the HITECH Act. And what that was incentivizing providers to become certified or leveraging technology in their practices. And so this is moving from paper, those file folders that were plentiful in the provider offices, now to computerized process and digitizing those records. And so providers are incentivized from a financial perspective to now leverage this technology up to about $44,000 per provider. So quite extensive from a dollar perspective. And so with meaningful use comes a lot of things. Not only does providers have to show that they're utilizing the technology, but they actually have to show at the end of the day that it's making an impact in their practice. So it's reducing costs, it's improving health quality in their patient populations. And so there's a staged approach to this. We're currently in the middle of stage 1 for healthcare professionals. Stage 2 begins in January 2014, with stage 3 in or around the 2016 timeframe. Healthcare professionals who don't begin to digitize their records and meaningfully use these technologies by 2016 will start to get penalized by the government. And so there is some motivation to get this certification and be able to get this incentive.